There are so many questions being asked about bringing your child to the dentist, and we have the answers for you. Hey y'all, my name is Amy Morgan, and I am the marketing coordinator here for Pediatric Dental Associates and Orthodontics. And in this video, we are going to be answering questions that have come directly from parents just like you. Starting off with, how often should I replace our family's toothbrushes? And that question can get a little bit confusing because there are two different times you're going to be wanting to replace their toothbrushes. So number one is there's a standard amount of time, which is every 3 months. A normal manual or even an electric toothbrush, the bristles will start to go bad at about 3 months. You'll start seeing them press down, they'll start not looking the same, the toothbrush head will actually start to look flat. Now, if you use an electric toothbrush, all you have to do on most of those is just get a replacement head for those. If you are using a spin toothbrush, which are really popular for kids because of the characters, you're actually going to have to purchase a new spin toothbrush. Those do not come with replaceable heads. And then also on a manual toothbrush, which is just going to be your basic toothbrush, you're going to be just throwing those away. There is a recycling program through Colgate that you can look into for that if you want to hold on to those for your family or bring them to our office. But there also is a really fun Quip toothbrush made by Crest Oral-B where you can replace the manual toothbrush head only, so you're not getting rid of as much waste. And here at PDA&O, we think it's really important to try to continue to take care of our environment while we are taking care of our teeth. And then the second reason you are going to be replacing your toothbrush is if anyone in the home is sick with something contagious. So this is going to be your regular cold or flu that can be contagious, any kind of stomach virus, as well as the COVID-19 virus. You're going to want to replace all of the family's toothbrushes that have been anywhere near the person with the illness. So if your children have been sick and they share a restroom, you're going to want to replace all of their toothbrushes. If your spouse or partner has been sick, you're going to want to replace their toothbrush as well as yours. Any shared area for the toothbrushes, you're going to want to replace all of those toothbrushes. At this point, the orthodontist would let you know if they are ready for an early phase of orthodontics or if they need to be put into the observation phase. The observation phase would allow us to watch your child every 6 months, and once they are ready for their orthodontics to be placed, we would then discuss a treatment plan that is right for you and your family. What ages do you see new patients? In our office, we see our new patients ranging from ages 0 to 15. If you do have an older child that is seeking a dentist, we promise to refer you to a trusted dentist within our area. A lot of parents ask, what do we do if our child has a dental or orthodontic emergency? And the answer is pretty simple, you just call us. We do have an after-hours line available on nights and weekends that is run by a dental assistant on call. We can usually address small injuries and falls directly over the phone, as well as signs of infection. We want you to understand as parents that it is okay to reach out to us for any reason that you may think that your child needs to see the dentist or the orthodontist. But we also want you to know that the only true dental emergency is if their permanent tooth has completely come out of their mouth. If this was to happen, please contact our office immediately. Another interesting question that we get is, why are my child's permanent teeth darker than their baby teeth? And the answer is pretty scientific, so we're going to try to break it down as simple as possible for you. The enamel on their permanent teeth actually forms differently. The reason you are seeing such a stark contrast is because you are seeing them side by side. Once all the permanent teeth have erupted and all of their baby teeth are gone, you will start to see them all look more one shade. And of course, everyone wants to know, do you take my insurance? And the answer to that at PDA&O is technically we file all insurances. Some of the details and how this all works out can get kind of complicated, but there are two basic types of dental insurance: in-network versus out-of-network. We are in-network with some plans and out-of-network for others. You are more than welcome to call our office and we'll be happy to look into your plan for you. In-network in general means that we have a contract with that insurance company, and it may allow a small discount off of your out-of-pocket fees. Out-of-network means that we do not have a contract with this insurance, and you will be responsible for the full fees after the insurance pays. Here at PDA&O, we do not let insurance determine how we do our treatment recommendations. We currently accept most Delta Dental plans, most Blue Cross Blue Shield plans, and most Cigna plans. We are also very proud to accept Our Kids, Delta Dental Smiles, and MCNA. Some parents ask us what our hours are and also how they can make an appointment with us. We have 2 locations, one in Fayetteville and one in Bentonville. Our Fayetteville office is open Monday through Thursday, 7 a.m. to 7 p.m. Our Bentonville office is open Monday through Thursday, 8 a.m. to 5 p.m. with a break from 1 to 2 for lunch. We also try to see some patients every other Friday. You can make an appointment on our website at smilesarewild.com, or you can call our office at 479-582-0600. This number actually allows you to make appointments at both locations. As a parent, I completely understand why we get this question from parents, and that is, how do I prepare my anxious child for their dental visits? When my daughter was 2.5 years old, believe me, we went through all of that with her anxiousness at the dentist. We've worked through it. She's now 21 and very happy to come to the dentist. And as a parent, I'm very proud of that, but I worked very hard to make that happen and had a relationship with our dentist that helped as well. There are actually 2 trains of thoughts on how you should introduce your child to the dentist, or if they had a bad experience in talking them into coming back to the dentist. So number 1, you can use show and tell. If they're coming to the dentist for the first time, you can have them use their dolls or their stuffed animals and do a pretend dental visit at your home. You can use your toothbrushes, you can use funny mirrors, you can use anything you need to make your house set up just like the dental office. And one of the reasons why kids get so anxious is because they actually have to lay down to see the dentist. And it doesn't seem natural to lay down to brush your teeth. So start teaching them now that this is how it will happen in the dental office, and you can do that very easily at your house. The second train of thought is actually not to tell them anything. Sometimes too much information can be very overwhelming for them. So for some kids, this option works. Make the appointment and show up at the building. It's as simple as that. One of the other main things that we want to stress to you as a parent is that we do not believe that children should be punished for having a bad appointment. Continue to encourage them, continue to bring them back to the office, and we promise that with every visit, it will get easier. Pediatric Dental Associates and Orthodontics was actually founded by a woman who was scared of the dentist as a child. Dr. Tanya Triplett was our founding partner, and she believed in making the environment one that is not only safe for kids, but also fun. Obviously, this can serve as a distraction for your child. Our waiting room has actually been designed around this idea. We are pediatric for a reason, and that is because we want to help them through this anxious time and get them to love coming to the dentist. This is so that as young adults, they will continue to carry through with their 6-month checkups, even when you are no longer making their dental appointments. Last, but certainly not least, our number 1 most asked question from parents is, when should I start bringing my child to the dentist? And we actually follow the guidelines from the American Academy of Pediatric Dentistry. They recommend that all children find a dental home by age 1. This is done so that the child can start getting used to routine visits, as well as getting acclimated to the environment. Several of the questions that have been asked today, we have actually covered more in depth in additional videos. Check out our playlist to find out more. As always, if you have any new questions and you need to contact us, you can comment below or you can contact our office.